Today, I'm going to go over the very subtle symptoms and signs of pancreatic cancer that you should never ignore. Because pancreatic cancer is one of the most devastating and misunderstood cancers out there. On one hand, it is one of the most treatable cancers if you catch it early. On the other hand, it has a reputation as a near-death sentence. And unfortunately, that reputation is earned. Because most people don't find out they have it until it's already spread far beyond where it started. And we need to talk about this because the numbers are getting worse, not better. In 2025, it is estimated there will be 67,440 new cases of pancreatic cancer in the US alone, and an estimated 51,980 people will die from it. Cases and deaths have been rising steadily over the past 3 decades, and this trend is particularly noticeable among younger adults, especially women, suggesting that this disease is now affecting different age groups than it did before. So this is no longer a conversation only older adults need to have. Here is why this matters so much. The overall 5-year survival rate for pancreatic cancer is 13.3%, which represents all stages combined. But for localized pancreatic cancer, meaning cancer that hasn't spread beyond the pancreas, the 5-year survival rate jumps to 43.6%. That gap is enormous, and it tells you everything you need to know about why catching this early is everything. So if you find this video helpful, share it with your family and friends, because awareness is the closest thing we currently have to a screening tool for this cancer. Now, before we get into the signs, let's quickly go over what pancreatic cancer actually is. The pancreas sits deep in your abdomen, tucked behind the stomach. It has 2 major jobs. It produces digestive enzymes that break down your food, and it produces insulin to regulate your blood sugar. Because of where the pancreas sits, tumors can grow for months or even years before causing any noticeable symptoms. And where exactly the tumor forms inside the pancreas determines a lot about what symptoms show up first and how early they show up. A tumor at the head of the pancreas, for example, tends to cause symptoms earlier because it's positioned near the bile duct. A tumor in the body or tail can grow completely silently for a very long time. Now, the first sign we have to talk about is jaundice, the yellowing of your skin and the whites of your eyes, and it's one of the most recognizable early signs. Jaundice is caused by the buildup of bilirubin, a dark yellow-brown substance made in the liver. When a tumor in the head of the pancreas presses on or blocks the bile duct, bilirubin backs up into the bloodstream instead of draining through the intestines as it should. And jaundice doesn't just show up in your skin and eyes. It can also cause dark urine as bilirubin levels in the blood increase, light-colored or even gray stools because bile can't reach the intestines, greasy stools that float in the toilet because fats aren't being broken down properly, and itchy skin as bilirubin builds up in the tissue. Now, there are other conditions like gallstones and hepatitis that can also cause jaundice, but here's the key distinction. Jaundice from pancreatic cancer is typically painless and progressive. Painless jaundice in an adult without gallstone-related pain should always prompt investigation for pancreatic cancer. The next sign to pay attention to is abdominal and back pain. And this one gets mistaken for other things constantly. Pain in the upper abdomen that radiates to the back is a common symptom of pancreatic cancer. This happens because the pancreas sits directly in front of the spine, and a growing tumor can press on the nerves running alongside it. Sometimes the combination of back and abdominal pain can make patients feel like there's a belt of pain wrapped around their middle. It often starts as a dull, vague ache that people chalk up to a muscle strain or digestive discomfort. And that is exactly the problem. It doesn't scream cancer, it whispers. But if that kind of pain is persistent and it is not explained by anything obvious, it has to be evaluated. Now, let's talk about unexplained weight loss and appetite changes, because this is one of the most common early symptoms and also one of the most ignored. Significant unintentional weight loss is one of the most common early symptoms of pancreatic cancer. It can happen because the cancer affects the pancreas's ability to produce digestive enzymes, impairing nutrient absorption. But there's also a second mechanism at play here, because cancer cells are essentially metabolic hijackers. They redirect the body's energy and nutrients toward their own growth. If you are losing 5% or more of your body weight in a month, that is very concerning. But even losing more than 10 pounds over an extended period of 3 to 6 months should be investigated if it can't be explained by a change in diet, activity, or medications. And closely tied to this is a change in appetite. You may feel hungry less often, or your stomach may feel full after only a few bites. Some people feel bloated after simple meals, or feel discomfort shortly after eating. Another symptom that needs serious attention is new onset diabetes, or a sudden worsening of diabetes that was previously well controlled. And this one is particularly underappreciated. The pancreas is what produces insulin, so when a tumor starts damaging those insulin-producing cells, blood sugar goes haywire. In some cases, especially in adults over age 50, a new onset of diabetes can be an early warning sign. If someone at age 55 or 60 develops diabetes for the first time, without any other obvious reason, that may actually be worth looking at the pancreas with a scan. Research suggests that a sudden onset of diabetes in people 50 or older may be an early sign of pancreatic cancer, especially in those who have experienced continuous weight loss or do not have a family history of diabetes. This doesn't mean every new diabetic has pancreatic cancer, most don't. But if diabetes shows up unexpectedly alongside other signs on this list, it is worth having that conversation with your doctor. Let's talk about nausea, vomiting, and digestive disruption, because these are symptoms people almost always write off as something mundane. Pancreatic cancer can cause a range of gastrointestinal symptoms, including nausea and vomiting when a tumor is pressing on the stomach or blocking the upper intestine, pale or oily stools when the pancreas is no longer producing enough digestive enzymes, and persistent abdominal bloating that doesn't resolve. Many patients with pancreatic cancer have diarrhea, constipation, or both. Diarrhea, consisting of loose, watery, oily, or foul-smelling stools, can be caused by insufficient amounts of pancreatic enzymes in the intestines. If you notice greasy, floating stools that leave an oily film in the toilet, that is your body telling you that fats are passing through undigested, and that is a direct sign that the pancreas is not doing its job properly. Now let's discuss one of the more overlooked signs of pancreatic cancer, and that is persistent, unexplained fatigue. Not the kind of tired that a good night of sleep fixes. People with pancreatic cancer will usually feel a lack of energy or physical weakness that is unrelated to physical activity. This can be associated with difficulty sleeping and a depressed mood. Cancer uses the body's energy at a high rate, which leaves you feeling drained. This fatigue often appears early, even before pain or jaundice. When that bone-deep fatigue shows up alongside any other symptom on this list, unexplained weight loss, abdominal discomfort, changes in digestion, that combination is a reason to push for answers. And now the most important sign of all, which is no sign at all. The difficult thing about pancreatic cancer is that people in the early stages may not experience any symptoms at all. Approximately 80 to 85% of pancreatic cancer cases are diagnosed at an advanced stage, when the cancer has already spread beyond the pancreas. This late detection is a major reason why pancreatic cancer has one of the lowest survival rates among all cancers. That is the brutal reality. And it is why knowing who is at risk and who should be proactively screened is just as important as knowing the symptoms. So let's talk about screening. Unlike colon cancer, there is no routine screening test that everyone gets for pancreatic cancer. There is no lump you can feel, and no screening test your provider orders as part of a routine checkup. But that does not mean high-risk individuals have no options. Annual screening with MRI or endoscopic ultrasound, which is called EUS, is suggested for high-risk individuals. The age to start screening depends on the underlying genetic condition, beginning at age 50 or 10 years earlier than the youngest relative diagnosed with pancreatic cancer. Now, who counts as high risk? High-risk candidates include those with 2 or more first-degree relatives with pancreatic cancer or carriers of hereditary cancer syndrome mutations. That includes mutations like BRCA1, BRCA2, PALB2, ATM, and others. Screening should be initiated at age 40 for CDKN2A and PRSS1 mutation carriers with hereditary pancreatitis, and at age 35 for those with Peutz-Jeghers syndrome. And here is the most compelling reason to actually pursue this if you are high risk. The 5-year survival among screening-detected pancreatic cancer was 73.3%, with a median overall survival of 9.8 years, compared to just 1.5 years for patients diagnosed with pancreatic cancer outside of surveillance programs. Let that sink in. That is the power of finding it early. For the screening itself, most guidelines recommend alternating between MRI and EUS annually to leverage the strengths of both modalities. Screening should ideally occur at centers with specialized expertise in pancreatic imaging and management of high-risk patients. And there is something important to understand about a blood test called CA19-9, which people often ask about. While CA19-9 has utility in monitoring known pancreatic cancer, its sensitivity and specificity limitations prevent it from being a reliable screening tool on its own. So do not assume a normal CA19-9 means you are in the clear. If you are not in a high-risk genetic category, but you have concerns, the most important thing you can do is not ignore symptoms that persist. If you are in a situation where 2 or more of these signs or symptoms develop at the same time, that could be an indication of cancer, and you should be evaluated. Trust your body, push for answers, and if your doctor dismisses your concerns, push again. Stay tuned because I will be making a follow-up video covering the causes of pancreatic cancer and what you can actually do to lower your risk, including the lifestyle factors that are driving the rise in younger people. Subscribe so you don't miss it. I hope this was helpful, and I'll see you in the next one.